Hey YouTube, I wanted to join you today and tell you about the 5 key players for a mental health team. So I know that some people are thinking like, well, shouldn't everybody be taking some type of piece in mental health for all students? Yes and no. If everyone is doing everything, then everyone would be spread out. So when I talk about mental health groups, I talk about there being a core team, and then you have the auxiliary members. Your core team are going to be those that are taking the action steps to meet the school's mission and vision through goals and goal setting. But then the auxiliary members are those that are carrying out tasks that are delegated to them, but are also helpful resources. So again, we have 5 key players. So let's get into the first one, and I'm pretty sure you'd already guess it. Number one are your mental health staff. So your school counselors, your school social workers, your school psychologists. These people are dealing with mental health regularly in their own jobs. So doing things or carrying out tasks that are related to mental health is not far-fetched for them. They're already doing things within their services that touch on that. So these would more than likely be your core members of your mental health team. All right, the second person would be administration. So it's funny because I feel like there's 2 types of administrators. You have the type of administrator that is all in and they want to know everything because they feel like they are the central nervous system of the school, so they want to be involved in everything. And then you have other administrators who are just like, I don't know that. Like, I know instruction, I know assessment. That's where I want to stay. But either way, administration is very important to have as a part of the mental health team because, they are the gatekeepers of the building. They give you the yeses and the nos. So you know what can be done, when it can be done, and just having admin there gives that added piece and a different perspective of what we can do structurally at the school system. Your third key player you want to have on your mental health team are your parents. So, like I said, a lot of these services are going to be given to their students. So parents are going to need say because their students are underage for the most part, of how their students are being serviced and what are their needs. And then, of course, parents have needs as well, too. So whatever services that you're giving to parents, that trickles down into what is being taught to the students. So that comes into number 4, which would be our lovely students. They need to be a part of your mental health team, at least as auxiliary members, in order to guide what you're doing. They could tell you if what you're doing is working, if they value what you're doing, if they want to see different things. That student voice piece is very important and very critical because, again, if we didn't have students, we wouldn't have a job. But like I said, when we talk about mental health, it's good to have their voice to stay relevant on what's happening in your school. And then the last person or last group of people that you want to have a part of your mental health team, and it's very important, is your community partners. So again, at a school, we can only do so much. However, when you have community partners, you're able to put people in a building that are skilled specifically to what you may have a need of. Like you can get very specific about what your school's needs are and find a community partners to plug in with that additional information and resources that students and families need. So again, I would say that the core members more than likely are going to be your mental health staff, and then your auxiliary members would consist of your administration, your parents, your students, your community members, because it is a whole team effort, but everybody can't do all of the work. So also, as I'm saying this, like I said, you guys know that I'm an education consultant. I do have a free training that is coming up Saturday, August 6th at 11 o'clock a.m. That's Central Time. And it is called The Impact of a School Mental Health Team. So if you're interested in starting your school mental health team, maybe you need to know more about, okay, what are the benefits of it? Or you may feel like you already have a team and want to know just what is the full gamut of what this team can accomplish. I'm having a training so that I'm going over that. So I want to be able to show those things to you so that if you're interested in, like I said, starting your own school mental health team, you kind of get that impact of what a school mental health team can do. So look for the link in the description box. Sign up for that. Again, that's Saturday, August 6th at 11 o'clock a.m. Central Time. And I will see you guys next time.